All right, we are going to show you the best two options to get rid of trigger finger fast and easy.
From clinical and Brad's own personal experience, these techniques work.
That's right, I'm going to share. All right, let's talk about the symptoms of trigger finger. They're very consistent with most people. I have it on my middle finger. When I flex my middle finger, when it's active, it'll lock right about there, and then I can no longer extend it up. It locks up, and if I really work hard on it, it'll pop up. Sometimes I have to take this finger and go up. It can be painful. It can be very painful, and most of all, it is annoying.
Some interesting facts about trigger finger. It commonly onsets around age 58. It is 2 to 6 times more likely to happen in women versus men, and the common areas affected the most are the thumb and your ring finger.
There you go. Now I'm going to show you a simple anatomy example or demo on why trigger finger acts like it does, and it'll make you more successful in getting rid of it. So what we have is the muscles in the forearm, and their tendons run through your carpal tunnel and up to the finger. We'll look at this finger, and it connects up in here. When that muscle contracts, the finger bends. Now what happens is the tendon, as it runs through this area of the palm right under the big knuckle, there is something they call literally the pulley, and the tendon needs to slide through that pulley as you flex your finger. So let's take a little model of this. The yellow rope is an example of the pull or the tendon. Goes down, connects up to the muscle. Now that pulley or the tendon has to slide back and forth. Pull, Mike, pull. There we go. Now we're exaggerating here, but if it does not slide through the pulley, because the tendon can actually get scar tissue and get some calcium deposits, there's other reasons that cause this tendon not to go through the pulley smoothly. We're going to go to this next and explain it clearly. All right, so we actually have a model that really shows why trigger finger locks up like it does. Here we have the tendon. Here we have the model of the pulley. Now, if everything is working good, when you flex and extend your finger like this, the tendon goes through the pulley very smoothly. Now, what can happen, like we talked about, a nodule or something forms on the tendon. We're not going to get into what it is, but here we have a model of the nodule by the red tape. So what happens is it gets caught in the pulley. Now, watch what happens. If you keep working it, it goes through and it clunks. And this is exactly how it feels, and your finger clunks. Now, if you work one of the two exercises, I'm going to show you. The nodule gets smaller, represented by the blue tape, and you can see, oh, it goes through easier, a little bit of a clunk, less trigger finger, less clunk, and once you get that nodule completely out, you go back to the normal motion of that tendon through the pulley, and voila! And it works. I use this technique all the time because mine comes and goes over the last few years, and it's very satisfying for me to have it work. We want to share with you.
So the first treatment option to try is to take your good hand and place it on the base of the trigger finger, typically around your first knuckle here. You're going to push down with your thumb in the region where you can feel it helping the most. Then what you're going to do is flex your finger and extend it. Now, some people it may be a little lower down here. Some people may be up. Just find the area that helps you be able to flex and then extend your finger and do 5 to 10 repetitions of this.
Right. And you'll actually do this throughout the day, every hour or two, and you'll find it'll go away quickly the more you do it. Now, the second option is actually a massaging technique. I'll put it here. Here's my actual trigger finger, and I'll put my thumb here, backing it up with my hand here, and I'm going to push in deep. This is a fairly aggressive, and I usually make circles. I either go right to left, up and down. Sometimes I circle it, but I'm literally trying to break up that scar tissue around that tendon as well as the pulley, and I'll do that simply for maybe 15 seconds at the most, and I will get, there we got a little trigger, there we go. It's locking. Let me work it a little bit here. Get that broken up so I can get a good free response. Little better. Now, if I kept working that, it'll continue to get better. There is no pain with the little bit of symptoms I have right now, so I don't worry about it. But when it gets painful and it locks up tight, that's my favorite. Then I'll also use a technique that Mike used as well. So any questions about that?
No.
If you do have a massage gun, it can be an alternative to the massaging. I would use either the pointy head, which is more aggressive, start out with the round head though for sure. The air head is really not shaped right for it, so I would stick with one of those two heads. Simply get on it. You're probably not going to go straight on, although you could try it. I would go at an angle this way, work it this way, and the big benefit of this is if you have arthritis in your thumb that you're working and you're creating pain and a sore thumb, this will eliminate that, and it's a nice option. Mike, do you have anything to say?
The whole purpose of these exercises is to get that nodule from the big red one we showed earlier down to the small blue one, allowing it to glide throughout the day.
That's right. Trigger finger and trigger finger no more. All right, getting serious, it does work, and I think it's a valid treatment. However, Mike has some tips if there's something different.
So if you have trigger finger in your thumb, we do have a separate video on that because the treatment options will vary a bit. So click the video link here on the screen.
Good luck.
Bob and Brad, the two most famous physical therapists on the internet.